Hey there, it's Michelle at Inhale Wellness Studio in collaboration with LASA OMS. Today we're talking about the Ito ES130 and its patient applications. In this series, I'm going to show you several different patients, the way the Ito is set up, what we're treating, and also hear directly from the patients about how they're feeling and experiencing the treatment. So get ready, let's go. Okay, so we're going to do a low frequency treatment for some carpal tunnel due to some muscle constriction from overuse with crocheting. So we've got our Ito set at low frequency. That low frequency, if you remember from past videos, is somewhere between 2 and 5 hertz. We're going to go at 2, which is going to put us between 4 and 6 on our frequency dial. So we set that. I'm going to go just a little after 4. Then channel 1 is hooked up. I'm going to start adding a little power to this, and I'm going to wait for my patient to tell me that she feels it. And what you're going to feel is like a little bump, a little contraction of your muscle.
I'm starting to feel it.
You okay?
Mm-hmm.
There's what I want to see. You okay?
Mm-hmm.
Okay, so we've taken that up to about 5 amps. And what we're seeing here is the contraction of the muscle. Okay, so on this low frequency treatment that we're working, you can see how low frequency causes the muscles to contract and relax. If you're wondering what's happening inside your patient, besides asking your patient what's happening inside them, your Ito is also going to tell you what's happening based on this green dot. Every time that green dot goes, you can see there's a muscle contraction. So every time you get a tap here, you're getting a tap on the muscles there. It's actually a couple muscles here. You can see how it's waving through the two of them. And if you look down the chain here, you can see how that's also affecting the fingers straight through the medial part of the wrist and into the fingers that connect to the medial part of the wrist. This is where she's having her pain. And so this is what we're using this treatment for. With this feeling of the muscles bumping, what are you feeling? Does it feel painful?
No.
What does it feel like to you?
Like a massage.
It feels like a massage.
Mm-hmm.
Okay. But no pain, no pinching, no uncomfortable feeling where you're like, I don't want to go through this anymore.
Nope, not at all.
Okay. Okay, so I have the Ito ES130 set on low frequency. And over here on the dial, we've got that pulsing at 2.5. That's what I'm looking for low frequency for this treatment I'm doing. So I've got that set close around 5. And then I've put on to the patient's comfort level the amount of electricity to go through it. And what we've got is an actioning here of the muscles that move the ankle. And so I've needled into the motor point here, and that is what's making the foot tap. And so this is a low frequency use of the Ito ES130 in work with moving ankle muscles to restabilize around the ankle joint. So if you're a new acupuncturist and you're doing this kind of motor point treatment, you might see this action happening with the foot and think that this is too intense for a patient or that they're feeling pain. So I'm going to have my patient chime in here and let you know what's going on. So are you feeling any pain at all?
Zero pain. I can feel the pulsing at the insert point and the tapping of my foot. That's all.
So no pain.
Zero pain.
She can just feel the motion of the foot, and she can feel the pulse of the low frequency electric going in to the motor point needle, which is the one you see in red there. Okay, so here's another example of the Edo ES130 in operation. This time we have it set at medium frequency, and down here on the frequency dial we're at 3. If you come here and look, there's no 3 on here, but it puts us between 23 and 30, and I'm aiming for 25. So I've got that set, and then we've got the leads on, and this is to the patient's comfort. So here we're at 3 amps, both on the first and second lead, and that's to the patient's comfort. Real quick, how are you feeling? Like, are you feeling any pain? What's it feel like to have these leads on?
No pain, just a slight little tingling.
Okay, so no pain, just a little bit of tingling here, and that's what a mid-frequency setting is. Provides a little tingle to break up pain, and we're working here in what is called a lower perfusion treatment for some low back and hip pain. So I hope you found this series helpful. I hope you found the patient input helpful. And at this point, I hope you feel comfortable to begin treatments with your Edo ES130. I would also highly recommend that you find a skilled practitioner to do continuing education to deepen your skills with how to create low frequency, medium frequency, high frequency treatments, why you would do that, how you would find the points that you want to needle, how you would hook up the leads for the most effective and safe treatments for your patients.